Here we go. Okay, so the body was meant to move. So a little bit about me. I've been practicing for 12 years. I have spent most of my career practicing in San Diego and Los Angeles. Um, you know, I think it's important for us to share why we got into this field. And for me, both of my parents were physically disabled. And I also grew up playing soccer, doing dance. I enjoy resistance training. So just a little bit about me and what makes me tick. I love the heart and the lungs. So just a little bit about myself. And then today, what are we going to talk about when we're talking together? So we know that genetic modulating medication is a really hot topic and really changing the lives of our patients, and that's so wonderful. And so I want you to be able to walk away from this presentation, whether you are a patient with CF or whether you're a family member of somebody, researcher, clinician, and use this presentation as a guide. I feel like this is the perfect opportunity for us to talk about how exercise can be used to maximize health and longevity. So now what I found out is that a large portion of our CF community is now struggling with some things that maybe they didn't struggle with before, maybe being on a genetic modulating medication. I talked to a couple of previous patients of mine, and one of them said they're struggling with weight gain. Another person said that they are struggling with hypoglycemic events, and that's not just one patient. I'm going to correct myself and say that this is something that the CF Center at USC had reported to me as well. So we're going to talk a little bit about that today. So when I titled this slide, "Some Things Are the Same," I did that because there are some people, you know, who are still going to be struggling with symptoms associated with CF, symptoms associated with lung disease. So maybe there are people out there who are on medication, but they are struggling with a little bit of shortness of breath. And then there are people out there who aren't on the medication yet because it's not available to them yet. So, you know, when CF and the symptoms associated with CF are a roadblock to working out, what does that look like and how can we help you with that? So whether you're dealing with the disease from a mild place or a severe place, I hope to create this presentation to be a place for you to start. And some things that may have been present in the past that are still present is that, you know, you may have pain. You may have trouble improving how you breathe on your own now that you are able to exercise in a different capacity. We're going to talk about stamina or endurance, strength, bone health, and confidence. So why am I passionate about working with CF? There is one patient who stands out in my mind. Her name is Leslie Patrone. Some of you may know her, some of you may not, but she is unfortunately no longer with us, but she inspired me so much. She fought this disease and fought for people with CF. And I'm going to show you a video at the end, time permitting, that will hopefully inspire you a little bit. So the body was made to move. The body is this amazing adaptive machine. It's this, except it's not a machine, right? Because machines don't adapt, but it's this amazing living thing. It responds to the challenge that you put on it. So when, you know, you see pictures on the internet or social media of people saying, I've been doing yoga for 3 years, and this is a pose that I previously used to do, and look at how far I've come in 3 years. It's because our bones, our muscles, our ligaments all respond to the stress that we put on it in a positive or a negative manner. So if you are not moving your body, it starts to hurt. You know, I'm going to go through the presentation and you're going to see different pictures of things that put strain on our body, and then we have pain. And, you know, I worked in the hospital for 10 years working with patients that were admitted for CF exacerbations, but also with people who were admitted for plenty of other reasons outside of the CF population. And no matter who you are, if you spend a lot of time not moving, your body's not as healthy. So the body responds to weight bearing. And the reason I have this little, heart rate up exclamation point is just to say that this is going to be really important throughout the presentation. It is important to challenge our heart rate. Okay, so what are some limiting factors in our life right now? We're no longer hunters and gatherers. We're not out there moving our bodies and climbing hills and lifting heavy things or carrying our kill back or what we've gathered back to where we live. So we're not moving like we used to. We sit much more than ever before. Hello, devices, right? Like, how many of us are sitting on our cell phones looking down like this and then wondering why our necks hurt, right? So there's phrases out there like sitting is the new smoking or sitting is harmful. And that's because everything slows down, right? So our GI system slows down. We don't take as deep a breath as we normally do. And typically we sit with poor posture. When we have poor posture, our chest cavity can't open in the way that was designed to. And, like I mentioned before, there's stress on ligaments and joints. So, here's another thing that we've all been talking about today is hello, COVID-19. We're stuck in our houses more than before. And so we're probably sitting. One of the other things is that there's fear and intimidation when it comes to starting an exercise program, not just if you have CF, but if you don't have CF. So it is a universal theme, and I hope to address that today. So I'm going to say it out loud, like I'm kind of a dork, right? Like I like looking at TED Talks, not all the time, but I can fall down the rabbit hole of watching talks, short talks, because I don't have the greatest attention span, short talks on why exercise is great. And it has been, clearly cited in the research as well. Exercise improves your mood. It gives you feel good neurotransmitters. And so, you're going to hear me talk about that today, but also just talking about the normal population, right? People in the world, even though I use the bad word normal, when you exercise, if you have a history of Alzheimer's in your family, it's been proven to have positive effects on diminishing that or postponing it, okay? And we know that exercise and physical therapy is used in patients with cancer diagnoses. It reduces chronic pain. I know that we were talking earlier about inflammation. Exercise reduces your inflammation and it helps with sleep. Sleep is so important in our body's ability to heal and be ready for the next day ahead. So, yeah, it's kind of the answer to everything if you're talking to a PT. So I'm going to present some articles to you. And some of them are old and some of them are new. And the reason I like to try to show them in this manner is because if you want to go find it and that's not part of your normal day-to-day thing that you do for your job, I felt like this was an easy way to be able to identify the article. So this is an article about sleep, and it discusses if you exercise in the morning versus exercising later on in the day, how does that affect somebody's sleep with insomnia? And I know our patients with CF or our individuals with CF struggle with sleep often. And so what this article said, and I know that it says older individuals, which I don't agree with the numbers because they said 55 to 65, which I don't really think is older. However, this is the population that they studied. And what they said, or what they found, is that patients or people who exercise in the morning had a better ability to initiate sleep or fall asleep, and especially for those who typically sleep later in the evening. And I know that that sounded just like my patients that I used to work with all the time, that they found that they stayed up later. So if you can exercise an earlier part of your day, it's going to help you sleep better. So this is a picture from the CDC, and it talks about exercise guidelines for adults, right? We start thinking, well, how much do I have to exercise and how is it going to benefit me? And here on the CDC's website, it shows that it boosts your mood, it sharpens your focus, it reduces your stress, and it improves your sleep. Okay. And so for me, when it talks about sharpen your focus, like talk about focus being in graduate school or just being in school, period, right? When your brain kind of shuts off, I was very lucky to have a classmate who had an exercise bike in our apartment. So I would sit on that exercise bike and study something that I found to be very difficult because it helps your brain. So when you hear about, oh, the recommended guideline is 150 minutes of moderate intensity aerobic activity per week, that can sound a little daunting. So the next slide is going to help break it down for you just to feel a little bit more user-friendly. The other thing that is recommended is that we all participate in some type of muscle strengthening activity 2 days a week, so for 30 minutes. So this is my own take on the previous slide, that one of the things I'm going to push during this conversation is walking, because it's simple for most of us and it's free for most of us, right? Like, I recognize you need to have good workout shoes, but this is something that I think makes it a little bit more tangible. So if you can go for a 22-minute walk every day after a particular meal that you find it easy to fit it in, 7 days a week, you're going to hit your moderate intensity aerobic goals by increasing your walking speed. And I recognize that if you're walking outside, depending on where you live and you know, how COVID is affecting the city that you live in, if you can increase that speed so that it's at a brisk pace for you, you're on the right track. So the other thing is, not the other thing, but if you want to do it 5 days a week and you do 30 minutes, you've met your 150-minute goal. If you only are able to do it 4 days a week and you do basically 38 minutes, you've met your goal, okay? So I just wanted to put this into a little bit more tangible numbers for you. And strengthening 2 days a week for 30 minutes. So you can see how this might be more possible for our adult population. And kids are different, right? Like, we think about, you know, PE being taken out of school in the past, because now a lot of kids aren't even in school, right? So we think about what is recommended for them to be healthy is that 1 hour of physical activity per day. So, you know, bicycling, running, playing tag, things like that, that they can do safely is recommended. And then strengthening exercises 3 times per week. And I'm using the word exercise because it's part of my normal lingo, but it can be using your body weight. So next, we're going to talk about exercise and bone health. So it is normal for bone to break down and build up. But when you have a disease process like CF, we know that your bone breaks down more quickly than others for a number of different reasons. And so when you have bone impact, then you're going to prevent bone from breaking down and you can improve its ability to rebuild. So when we say resistance training, that can be your own body weight. And it can include walking. And there's some information out there that says walking doesn't help improve it, but it stops it from being worse. But I think it just depends on where you're walking and how you're walking. So what's something that basically everybody can do at home is heel drops. And this is something that I learned in particular from another physical therapist, Ann Swisher, at a previous cystic fibrosis conference. And so if you're doing heel drops where you go up on your toes and then come down pretty firmly, then you're going to be helping yourself with bone health. And I couldn't find it, but I'm 99% sure it's 20 heel drops 5 days a week. All right, so what are the benefits of building muscle mass? So again, how you treat your muscles on a daily basis determines if they will shrink or grow. When I sat on the lung transplant committee, you know, we knew that the more physically fit somebody is, the healthier they are. And for those of you who are struggling with weight control, improving your muscle mass through strength training is going to help control your weight. And unfortunately, everyday activities aren't enough. So taking out the trash, maybe walking that 13-year-old dog that you have, doing the dishes just isn't enough. So building muscle mass is through micro damage. If I'm lifting weights, that is challenging for me, and I have muscle soreness for the next 2 days, that's actually a sign that I'm building muscle mass, okay? So that's a good thing. And I might be speeding up a little bit just because I want to make sure we get through all the slides. So how does exercise affect the lungs? So we've talked about bone, we've talked a little bit about muscle, and now we're going to go deeper into the lungs of somebody with cystic fibrosis. And this does happen in people who don't have CF, but I'm gearing it towards you specifically. So when you exercise, there is an increase in the surface liquid in the airways. And you see the gray or the black and white picture, that's the cilia in the lungs that basically beats to help move foreign bodies out of the lungs, okay? Get up into the airway so it's easier to cough out. And so when you exercise and you have CF, that airway surface liquid actually allows the cilia to work the way that they're supposed to. And so it's easier to clear your secretions. And 30 minutes of airway clearance, 30 minutes of exercise is considered an airway clearance technique. And I have that comment that says old news because this information became really popular when I was working in the hospitals in 2011. And it kind of blew my mind that what we were seeing in people was actually happening in the research. So this article, which is from Chest, which is a, holds a lot of weight, this particular journal, for those of you who don't know. It's talking about exercise improving the ability to clear your mucus. And this study looked at a group of people who used a treadmill and who used a bike. And those who used a treadmill actually were able to clear secretions better. And that's probably because of the movement of the body and the vibration that they had while moving. And this is another, 2011 was apparently a very big time for exercise in the CF community and studying it. And this article, again, was like the jaw-dropping article for me, that exercise is medicine in cystic fibrosis. And so I have some notes because this article is a little bit challenging to read. It is very scientific, and it has a lot of physiology. This happens in this channel and this happens in this channel. But what this article shows is that exercise can reduce the rate of decline in pulmonary function. Holy moly, like, I'm gonna say that again. Exercise reduces the rate of decline in pulmonary function. And so there are cellular changes that happen in your body when you are exercising, okay? And it improves the ability of the fluid in your lungs to move mucus out. But when you exercise, this article talks about it improves your survival rate, and actually 8 years, adding 8 years onto your life. That's a pretty big deal. So I'm going to keep going. So back to my patients or my friends who are on the genetic modulating medications. There's potentially, an increase in hypoglycemia that people are experiencing. And when you exercise at a moderate level, and an example of that can be walking quickly at a speed of 3.0 miles per hour on a treadmill, so moderate, that causes your body to burn up more sugar. So therefore, your blood sugar could drop during the exercise or after. And some of what I found says even up to 24 hours later, depending on the intensity of your exercise, right? So my recommendation is to be prepared. Fanny packs are back in. And so have a snack. I wrote a granola bar, but have a snack that works for you. If it's like a running gel or something that's been recommended by your physician to take, then that's really important for you. Have some phone numbers in there of people that maybe somebody should call, and a medical ID. I talked to one of my CF friends, and he said, believe it or not, like I was found passed out because I had a hypoglycemic event. So let's be prepared. So taking a step back, accountability, motivation, and fun. I like this picture because I thought these two women looked like they were having a good time, probably dancing to some music. Exercise isn't easy for anybody, right? Like there's roadblocks and barriers to it. But what are some things that make you more successful? Get a buddy. I have friends that I will text like, hey, I'm going out for my walk, or I walked 3 times this week, or I ran this week. That's going to help hold you accountable. And that's why a lot of people hire trainers, right? Like it's you paid money, you're invested, you're going to be going. And yes, they know what they're talking about, hopefully, right? Schedule it. Put it in your planner. Put it in your phone as a reminder of, okay, I'm going to exercise this morning after I do my meds or before I go to work or before I log on to the Zoom, and get that 20 to 30-minute walk in. If it's boring, guys, you're not going to do it. You have to like it. So things that people do is they listen to podcasts, they listen to books. I personally love listening to music. You know, get inspired, whether that means reading stories about other people who are out there doing great things with disease processes, and they're using exercise to improve their quality of life. You know, I just going to be honest, like I struggle with anxiety. Like I, you know, have stress for different reasons, just like other people in the world. And I like to listen to angry music when I work out because it helps me push myself a little bit harder. So going back to walking, 20 to 30 minutes a day, okay? The talk test, and I recognize that right now during COVID, this is challenging because if you're outside and you're wearing a mask, it is hard to talk to people, right? But you should be able to have a conversation with somebody while you're exercising and not feeling so out of breath that you can't recover. All right. And walking is free. Like you don't need a gym. And with COVID, they're closed down right now. And even if they weren't, I know there's a lot of people with CF who don't want to be in gyms for many different reasons. And so focusing on the exhale is just a phrase that I like to use when I'm working with people and they are getting short of breath. When you are working hard and maybe you're nervous or maybe you're focused, you might breathe a little bit more shallowly. And so when you do that, you're not filling your lungs to the capacity that you need to help prevent that shortness of breath. So when you recognize that you're having some shortness of breath, if you can focus on the exhale, that's going to make a significant difference in your ability to catch your breath. So I'm just checking my time. All right, so previous problems. So I can't imagine that if you're on new medications that everything has been fixed, right? So we know that if you have you know, bronchiectasis and breakdown of your airways, that those don't go away. So exercise can be helpful with that. Exercise can be helpful if you have pain. You know, in previous discussions, I've talked about how much people have coughed, even when they weren't in a phase of exacerbation, and how it's like hundreds of times in a day. And what does that do to your body? Whether it causes pain in your neck or pain in your back, and you know, it contributes to urinary incontinence, which is something that physical therapists can help you with as well. So I like to use pictures of anatomy to show you that it's all connected, right? That if you're coughing constantly or were, you are going to have some areas of pain that may not go away. And when I say it's all connected, like look at these muscles and look at where they all connect. They all connect to the spine, to the ribs, and that's all part of your respiratory system. So, you know, there's this wonderful fairy godmother of physical therapy, Mary Massery, who I love learning from, and she's so amazing. And she helps us really understand that postural muscles are respiratory muscles. So if you have or had trouble with breathing and posture, we can help you, and exercise can help you with that. This is just another picture that I like to show when I'm working on education that talks about the muscles in the front, that pectoralis minor that pulls those shoulders forwards and attaches to the ribs. And when you cough, that muscle is active, okay? So just, going backwards for a second, everything's connected. So let's get a little bit more specific. For those of you on genetic modulating medications, I think it's important that you talk to your doctor, talk to your team about starting an exercise program. They may recommend exercise testing. I think what's maybe frustrating for some people when you come to presentations like this is that it is very general, and you may have a very specific question about you, but I need to give you general information. So exercise testing is something that helps us understand how much we can push you and how healthy you are currently. And then we check it later on to see your improvement. If you don't know where to start, go back to walking, okay? Walk quickly, faster than your normal pace. Am I beating that into your head already? And so here's like another big piece of meat to take away from this presentation. High intensity interval training works. And so what does that mean? That looks like, for example, 1 minute of challenging exercise and 15 to 30 seconds of a standing rest. So if I'm going to do an exercise like this person, I'm going to try to do it for 1 minute. I'm going to have a timer set up, and I'm going to pay close attention to that timer. And I'm going to keep going as long as I can. Okay, this works for people with diminished lung capacity. And so here are some studies out there with the effect of high intensity interval exercise rehab in CF. It is safe and it's effective. So if you are somebody who can't exercise or don't feel like you can exercise because you struggle with shortness of breath, you can exercise in bursts and then take a rest. Exercise in bursts and take a rest for a total of 30 minutes. And it's been proven to work in children. This article is talking about typical children, but it's even working for children who are in the age group of 5 all the way to 18. And so, we're talking about in this country like dealing with obesity, right? And so high intensity interval training works for kids too. This article is basically here to kind of show you that exercise testing is how we determine if you're fit or not. And you are not just your FEV1. FEV1 is the gold standard. It is super important in how we take care of our patients with CF, but cardiopulmonary exercise testing gives us a better picture of you and your health. All right, I'm going to try to wrap things up. So for those waiting on their specific genetic medication, exercise shouldn't make you feel worse. And again, the recommendations are going to be similar, whether you're on meds or not. Talk to your doctor. Maybe there's medications like specific inhalers you should be taking before you do your exercise to help you tolerate it more. And modifications are the key. That's where we come in and we can help you. So if you're thinking, okay, I'm not on the medication, I'm at home, what can I do? Where should I start? Start with 30 seconds. Do 30 seconds of work and 1 minute of rest and see if that works for you. This is going to be really important for people who are preparing for transplant, okay? Because this is a way for you to exercise. I've done it a number of times with my patients. They enjoy it, and it really helps with your stress. So here's another article about interval training with patients with cystic fibrosis. It even works for those who are severely affected, even if you're on oxygen. I felt like I didn't have enough research, and now I feel like I might have too much. So something else I want you to take home with you. So when you exercise, your breathing rate and your heart rate is going to go up. That's normal. Increased demand, and therefore you're going to have those increases. But I want you to be able to feel like you can recover, like you can get the air in. And so if you're not, and you're feeling like you can't get away from that feelings of shortness of breath or air hunger, right? Like this young woman looks much more uncomfortable than this young woman. When you're feeling air hunger, usually it makes you feel anxious, doesn't feel like you can recover. My question is, are your oxygen levels low? Are you breathing too shallow and too fast? So if you want to write something down, if this is pertaining to you, focus on slowing your breathing down and make a few of your exhales long, and then your inhale will follow. So where do I start? Walking, squats. Squats are hard, but they work. And also postural muscles, a rowing exercise is a fabulous place to start, okay? When we are talking about patients, even patients that are in their 90s, out of the CF population, how do we know if they are healthy? What is their walking speed? Can they get out of a chair without using their hand? And what's their posture look like, okay? So these are some things that apply to the general population, but you guys as well. And right now, because of COVID, thank you, COVID, working out at home, we're kind of forced to do that more, right? So there are plenty of opportunities to find things out there that are free or very low cost. So here are some of my recommendations. If you're somebody with back pain or muscle pain, I think purchasing a foam roller, which can be around $20, is really beneficial. And if you are able to work with a healthcare professional that can show you how to do this, it can make a big difference in your back. I sit so much now, and I use mine all the time. Having a yoga mat is nice, especially if you have a hard floor. I think having a pulse oximeter is important because if you are not used to finding your pulse and taking it, you can get false numbers. And I think that those false numbers can maybe scare you a little bit. And so with a pulse oximeter, you're going to be able to see what your oxygen is, and you're going to be able to see what your heart rate is. The caveat with that is that I want you to use it as a way to give yourself comfort, but also know that it's not perfect, right? So when you put it on, give it 5 to 8 seconds to register before putting it on and thinking, oh my gosh, my heart rate's 160. Supportive tennis shoes are really important. I know that there are people out there who believe in barefoot running. I just haven't met that many people who have that perfect postural alignment. So why not wear supportive shoes? There's something free on YouTube, Yoga with Adriene. She's fabulous. She's funny. You could literally put in Yoga with Adriene, yoga for anxiety, and she's got, 30-minute classes. She's got 17-minute sessions. And in 2014, we did learn at the Cystic Fibrosis conference that the head down position is really not recommended for people with cystic fibrosis anymore because of the risk of silent aspiration, which can lead to pneumonia and being admitted to the hospital or needing antibiotics. And so I don't really know what that's like on Trikafta. So just be careful with the head down position. Couch to 5K, if a 5K is something you want to do, it's a $3 app and it is wonderful. Nike Training Club is another free app that exists out there. And now that I'm on this slide, I'm going to say that I have nothing to disclose. I'm not supported by any of these groups or companies, but I would like to be if you're thinking about it. So use us, use physical therapists. Telehealth or telemedicine brings us to your home, which is a place that we could never be before. We are limited to the states that we are licensed in. So I can't treat somebody outside of California, but we're here to work with you. We're the mix between a doctor and a personal trainer. So we're here for you.